Hi, I'm Kristen Taylor. I'm a physical therapist at Midwest Orthopedics at Rush Physical Therapy. In this video, I'm going to review how to transfer safely into your bed. It's important to remember after surgery for the first 2 to 3 weeks that we don't want to excessively use those muscles on the front of the hip, our hip flexors. It's okay to use them on occasion, but initially, right out of surgery, we should be assisting them with either our arms or our non-surgical leg. So I'm going to first talk through the transfer, and then Chris is going to demonstrate. So when we come into the room, we want to have our thighs touching towards the back of the bed. We then want to place our hands behind us, hook our non-surgical leg behind the ankle of the surgical leg, and then you're going to use your core and your non-surgical leg to assist you into that supine position. So let's go ahead and do this. Chris, we're going to place our hands to the back of the table. We're going to hook that leg underneath the surgical side. Good. And then swing that leg over. Good. And he can actively uncross his legs once there. What we're going to go over now is transferring stand to sit and return to standing. So what we're going to do is we're going to use the crutches to do this. The first thing we're going to do is make sure that the chair is close to us and it's touching the back of our legs. Next thing we're going to do is we're going to take both crutches and put them onto the non-surgical side. You're going to place your hand on the inside and make sure they're right next to you so they're within your base of support and you can use them for support on the way down. Next thing you're going to do is with your right hand, if that's the surgical side, you're going to reach back for the chair. Your surgical side is going to slightly go out in front of you as you sit down. So this will avoid that excessive hip flexion that we don't want to do in the first 2 to 3 weeks of surgery. In order to return to standing, those crutches will stay on this non-surgical side. We're going to bring them close to you so that you can use them to assist you. You're going to use your good side to assist in standing. Surgical leg will remain just slightly in front of the other leg to avoid that excessive hip flexion. Remember with hip flexion, it's your knee coming up towards your chest, but it's also your chest coming down towards your knee. And we don't want to pass that 90 degrees in our first 2 to 3 weeks after surgery because we don't want to put too much stress on that surgery site.